tonight we're all coming together to talk about, learn about, and watch a film related to climate change. The reason that we're all coming together is to talk about the health dimensions of this and how climate change and the changing environment makes us feel.
The film is based around an ice coring expedition of mine that took place very recently on the summit of Canada's highest peak, Mount Logan. It turned into a very personal piece about why I do the kind of work I do, and having the National Geographic platform and having this film has allowed me, I think for the very first time, to not just feel like I'm speaking to the choir.
The traditional structure of the university is that we would all study within our individual silos, and we would never come together to really collaborate about these common problems that we're now facing these days. So the university has really broken down these silos so that we can bring together these minds that have all these different perspectives together, including an Indigenous perspective, so that we can really start looking at these problems with the climate change and the hub, so that we can tackle them together.
If we can take the understanding from the climate science and the impact on the lives of people on the ground, I think that's where kind of the public health aspect comes in. And when we can merge these disciplines, we have a different understanding of an issue from different angles, and the idea is that we'll be able to emerge different kinds of solutions. My hope is that the Climate Health Hub can inform some of the research and evidence understanding and help us do a better job.
I'm a visual artist, and I'm interested in how culture and creative work might play a role in thinking about climate change. And so I made a series of images that were sort of kind of calls to action, were about urgency, and about thinking through how we could talk about the kind of political dimension of climate change. On the one hand, I want to see change, but I also recognize it's very complex. So the Health Hub seemed to me to be, well, maybe this is a place where many people can get together and think through this complexity.
When you have nights like this where there are other researchers, other members of the university community, other members of the Edmonton community coming together to talk about this topic, you realize that you're not alone, and that interconnectedness and this opportunity to connect with each other does give me, it's a source of hope, and it's a space for people to come together and talk about this really important topic.